Hello friends, myself Ruchi Patel, working as assistant professor at LJ College of Physiotherapy. Today I am going to take second year topic, that is joint structure and function. So let's start with the definition. Joint is nothing but the junction between two or more bones or cartilage. So let's go in the detail about the joint and its classification. So classification of the joints mainly given according to the functional level, structural level and regional level. We'll see first according to the functional level. To remember this functional classification, we'll use the mnemonic, that is SAD, SAD. Here S stands for the synarthrosis, A for amphiarthrosis, D for diarthrosis. So let's start with the synarthrosis. It's a almost immovable type of joint. Cranial sutures of the skull and the primary cartilaginous joints in the growing children are this type of joints. Next is the amphiarthrosis. So it's a slightly movable type of joint. Between the joint surfaces, we have intervertebral disc or cartilaginous pad. Okay, so which helps or which reduces to excessive friction, or the it works as a shock absorbent. Okay, so the pad of cartilage which lies between the two bone surfaces. Okay, so the joints between the two adjacent lamina, it is this type of joint. Next is the diarthrodial or diarthrosis. It is also called as synovial type of joint, and it is freely movable type of joint. Here the some of the movement, it is restricted by the shape of the articulating surfaces as well as by the ligaments which holds the bone together. Next is the structural classification. To remember this structural classification, we'll use the mnemonic, that is CSF. Okay? C stands for the cartilaginous type of joint, S for synovial type of joint, and F for fibrous type of joint. We'll see in the detail one by one. First, that is the fibrous type of joint. As we all know, it is immovable type of joint or slightly movable type of joint. It is composed of the fibrous tissue and with no joint cavity. The cartilaginous type of joint, it is articulation of the bones through the cartilaginous hyaline cartilage, okay, with no joint cavity. Whereas synovial type of joints are the joints which are separated by the fluid filled cavity, okay, and it has a synovial membrane as well. So again we'll see the structural classification. Fibrous type of joint, it includes the sutures, syndesmosis and gomphosis. Whereas cartilaginous type of joint, that is the primary cartilaginous type of joint and secondary cartilaginous. Whereas synovial type of joint, it is ball and socket type of joint, ellipsoid joint, plain synovial joint, then hinge joint, bicondylar joint, ball and socket type of joint and pivot joint. Okay, we'll see all the joints in the detail. So first is the sutures of the skull, then the second is the cartilaginous type of joint uh, to attach or the joint which is formed by between the pubic symphysis, whereas the knee joint is the synovial type of joint. Then fibrous type of joint, as we all know, it includes three subdivision, that is sutures, syndesmosis and gomphosis. So first sutures, and these articulating surfaces are connected by a thin layer of connective tissues, whereas syndesmosis are connected by considerably greater amount of connective tissue than the sutures. Okay, so it's a slightly movable type of joint, and the joint between the radioulnar, that is the introosseous radioulnar joint, is this type of joint. Then gomphosis, it is also called as peg and socket type of joint, and the articulation of the teeth in the alveolar socket of the mandible and maxilla by the periodontal ligament. Then cartilaginous type of joint, primary cartilaginous type of joint. The bones are united by the plate of hyaline cartilage. Costochondral joints are this type of joint. And these joints are temporary in nature because after certain age, the cartilage plate it is replaced by the bone. Next is the secondary cartilaginous type of joint. This type of joints, or we can say the articulating surfaces, are covered by thin layer of hyaline cartilage and united by the disc of fibrocartilage. So these joints are permit uh, slight movement, as well as this type of joints are permanent joint. Next is the synovial type of joint. Here you all can see this many joints in the body are synovial type of joints. So it's almost freely movable type of joint. It has a cavity which is filled by the fluid, and it is also called as diarthrodial type of joint. So when we say this is a synovial type of joint, then of course it should have this all the components. The components includes fibrous capsules, bursa, ligaments, menisci, then cartilaginous plate, that as well as synovial membrane. Okay, so this all the structures should be present when we say it is a synovial type of joint. Now we'll see the classification of synovial joint according to the shape of the articulating surfaces. So I'll not repeat again. We know the different type of synovial joint. Now we'll see in the detail of individual joint, that is plane joint. And here the articulating surface are more or less nearly flat and allowing the gliding type of movement. Intercarpal and intertarsal joints are this type of joint. Next is the hinge type of joint. When we talk about hinge type of joint, directly in the mind it will come, that is the elbow joint, right? So here it is the articulating surfaces are pulley shaped and the movements are permitted only in the one plane. The most common type of joint and elbow, ankle, interphalangeal joints are this type of joint. Whereas the pivot joints, so the rounded end of the one bone which fits into the concavity of the another bone, and the rounded part is surrounded by a ligament. So proximal radioulnar joint are the example of this type of joint. Condylar type of joint, so round articulating surfaces of one bone fits into the socket type of articulating surfaces of the another bone and permits the movement in the two directions. So knee joint is the this type of joint. Whereas the ellipsoid joint, this elliptical convex surface of the one bone articulates with the elliptical concave surface of the another bone and permits movement into two direction. So wrist and atlantoaxial joints are this type of joint. Next is the saddle type of joint. It is also called as the sellar joints. So here articulating surface are reciprocally concave convex. So both the surface have convex and concave surface. Allows a wide range of movement. So first carpometacarpal joints and sternoclavicular joints are this type of joint. Next, ball and socket joint. Again, when we talk about ball and socket joint, in our mind, directly it will come, that is the shoulder and hip joint, right? So this, both the joints are ball and socket type of joint, and we know it has a majority of the range of motion. So it has a three plane movement which is possible in this type of joints. Okay, so greatest range of movements is possible in this type of joint. So according to the plane of the movement, it is uniaxial. Only one plane movement is possible, hinge and pivot type of joint. Biaxial, condylar, ellipsoid and saddle type of joint. Whereas multiaxial, that is ball and socket type of joint. So here the movements which are possible in the three planes. Okay. So here the example of different joints are given. Then third is the number of articulating bones, which classifies the joints into the simple joints. Here only two articulating surfaces forms the joint. Compound, here the more than two articulating surfaces are formed the joint. That is, we can say that elbow joint is a compound type of joint. Then complex type of joint, more than three articulating surfaces are there and which provides the motion. Next is the regional classification. So according to the regional classification, we'll divide the joints into the skull, that is the immovable type of joint, vertebrae, that is the slightly movable type of joints, and limb, that is freely movable type of joint. So this is all about the joint classification and definition. So for the further detail, you all can refer the Joint Structure and Function by Cynthia Norkin and the another book, that is B.D. Chaurasia. You can refer, and in the detail it is given about the joint classification. Thank you.